Good morning, everyone. Welcome of you joining the information session hosted by the Occupational Health Centre. The session is about international student workers in Manitoba, learners, earners, and Yearners. So it's presented by Hafiz Jatto and Dorothy Wigmore. Hafiz Jatto, he was the project coordinator of the International Student Workers Project, and Dorothy Wigmore, she is the occupational health specialist. I know, Dorothy and Hafiz have lots of information is going to share with you. I now want to welcome them and pass it to Dorothy and Hafiz.
Thanks, Tiffany.
Thanks, Tiffany. Morning, everyone, and thank you for being here. Really appreciate it, and just your interest in learning about this work and the work you do, possibly supporting international student workers in Manitoba. Thank you, Tiffany, for hosting us and supporting us with tech today. If anyone is having any technical difficulties, you can send a private message to Tiffany as well, or email the email you got for a reminder, just in case you're not getting the slides, audio, or anything like that. Dorothy and I have about 40, 50 minutes of information to present, and then there's time for questions at the end. If people do have any questions at any time, you can put it in the chat, or feel free to interject by raising your hand with the reaction button there.
And I hope that you can keep an eye on the hands there, because I can't see anything.
Oh, for sure. Thank you for sharing this. Tiffany and I got the chat and the hands. Thank you.
So would you like to go? We'll go to the land acknowledgement then.
Perfect. Thank you. Awesome. Thank you, Dorothy, for sharing. I really appreciate everyone being here. I just want to take a moment to acknowledge that we are gathered on Treaty 1 territory, and that Manitoba is located on the territories of the Anishinaabe, Anishinaabe, Dakota, Dene, and Nehetowoc nations, and is also the national homeland of the Red River Métis Nation. We acknowledge that northern Manitoba includes territories of the Inuit, and as we gather, we also want to recognize Treaty 3 territory, in particular Shoal Lake 40 First Nation, which is the source of Winnipeg's clean drinking water, as well as Treaty 5 territory, including Nelson River, which provides us access to most of our electricity. So the OHC acknowledges the devastating, lasting, and ongoing impacts of settler colonialism on Indigenous peoples and the deep lack of action towards truth and reconciliation. As an organization, the Occupational Health Centre has embarked on a process of learning about Indigenous peoples' history and the culture and the role that we play as settlers within the staff, board, and volunteers under the guidance of knowledge keeper Sandy Clayton. The OHC commits itself to active accountability, truth, justice, equity, and reconciliation. And and it's common these days to start meetings with land acknowledgements or trainings or just gatherings. It's a important moment to pause, to acknowledge the land on which we gather, to reflect on the devastating history of colonialism and how that affects Indigenous peoples continually to today. And also, again, in reflection, think about how the work we do could contribute towards reconciliation and somewhat pause some of these systems of extraction and exploitation. Looking at Indigenous peoples and occupational health and safety, there is unfortunately some sad similarities in the negative employment outcomes, negative health outcomes that is also shared with the demographic we'll be talking about today, international student workers in Manitoba. Let's pass to Dorothy if she wanted to add a few words on the land acknowledgement.
No, just the thing that might be useful for people to know is that the Occupational Health Centre some years ago did a project around Indigenous peoples and health and safety, and I think that the materials that came out of that are still on the website and are an important resource and unique one too.
Awesome. Thank you, Dorothy. Let's go to the next slides now, just to share a little bit about ourselves. Sure, I'll go first. I moved to Winnipeg about 10 years ago as an international student, so this work is personal to me. I have a labor studies degree, and I've, over the last 6 years, really studied the intersections of labor and immigration while serving a variety of roles in the community sector, either as a project manager or policy analyst. Being really grateful to work to serve the community and generate knowledge that improves our experiences, whether it's reducing barriers in systems that may be systemically racist or just may have not been designed with the intention of being accessible to the folks that use the systems, like the International Student Program in Canada, or supporting Indigenous youth in the foster system, supporting newcomers to Winnipeg as a whole. I do see a lot of similarities in these spaces, and we'll be talking about some of these issues today. And I'll pass it on to my co-author, Dorothy. I'm so grateful for his support and work on this.
Well, thanks, Hafiz. It's been fun. So I was the center's first occupational hygienist. I trained in that field as well as in ergonomics and things to do with stress. Been a researcher, educator, and as Hafiz learned in what we're doing, I'm really a fairly enthusiastic body and workplace mapper. I have worked in Canada, the States, and Mozambique, and in a lot of sectors. One of the current projects I'm working on is writing about workers' experiences in this pandemic and what I like to call transmission truth, that the SARS-CoV-2 virus is in the air, and so we need clean air, and the sciences that have been harming or protecting us. So in terms of what we're doing today, we're going to just start out with a little bit of information about the Occupational Health Centre and the cross-cultural community development program that this international student project sort of grew out of, as well as the project. And then the idea here is we're going to talk, this is sort of following the report that we've done. The idea was, how do we connect with students? What did we hear? What kinds of recommendations did we make? And the next steps. I think the next steps are, may not be on a slide itself, but we'll get to them. So in terms of the Occupational Health Centre, and there was a then, and so back in the early 80s, unions in the province were responding to hazardous working conditions. There were doctors were not supportive at all when it came to workers' comp claims, especially around lead, and workers' comp was failing to accept claims for things like lead poisoning and other harm. Doug Smith has talked about some of this history in this little booklet called An Injury to All that includes some history about the Occupational Health Centre. So the center itself opened in 1983 at the corner of Sherbrooke and Westminster after unions had raised funds for it and dealt with renovations. The person here with the microphone is Dick Martin, who was the president of the Federation of Labor at the time and a keen proponent of the Occupational Health Center. On the left, as you're looking at it, is the premier at the time, Howard Pauly. On the right, Lisa Donner, who was the first director, executive director at the center. And they're surrounded by faces that I recognize, people who were involved in helping it get started. So the staff included some doctors, nurses specializing in occupational health. There was a hygienist at the start, me, and an admin person and the executive director. These days, the center has wandered over to the Union Center and then now is working out of the same building as Clinic on Sherbrooke Street. And in terms of the how the center sees itself, in terms of a vision, it's about healthy workers, healthy workplaces, and healthy communities. The mission is to deliver services and programs that enhance the capacity of workers, workplaces, and communities to protect their health and safety. And the values are worker-centered, inclusive, in terms dealing with health equity and integrity. Hafiz.
Hafiz, you're on mute.
So sorry about that. I usually don't make that pop up. In terms of strategic priorities, I do want to highlight number 4, which is to engage in meaningful equity work, such as strengthening connections to newcomer, Indigenous, and Black, Indigenous, people of color communities, advancing towards the Truth and Reconciliation calls to action and the murdered and missing Indigenous women and girls Two-Spirit calls to justice, ensuring programs and services integrate an equity and cultural safety lens, and to weave equity work into the OHC. As long as with the other 3 strategic directions, I think this really comes to fruition in programs such as the Cross-Cultural Community Development Program on the next page, which sort of led to the development of this international student worker project on an 8-month term. Thank you, Dorothy. So the Occupational Health Centre does offer a variety of programs still, and thank you for that short history, Dorothy. I really appreciate your wealth of knowledge and the fact that you've been here from the beginning. So you've seen it all. Workplace psychological health and safety was led by Jeffrey Thompson, our occupational health nurse, education, training, and programs with post-secondary institutions, employers, and other public and private institutions, or ergonomic assessments and training on a one-on-one basis. Occupational medical care, definitely more supportive for folks with their workers' compensation claim, just assessing their bodies to see whether they're developing a multiple stress injury or developing an adverse reaction to the way that their work is being set up at the time. And the cross-cultural community development program, really the focus of this page here, takes a train-the-trainer model and really tries to integrate community development values to provide resource counseling and provide really training to workers, newcomer workers, racialized workers in Winnipeg, in Manitoba, taking again that train-the-trainer approach to identify community leaders, work with them on a 3-4 month basis, train them on occupational health and safety. Thank you, Dorothy. And in the last 25 years, we've had training sessions with over 24 cultural communities, and the trainers are able to deliver these workshops in their first languages, again, about basic health and safety, workers' compensations rights. We've also developed materials and videos in multiple languages, and the feedback we get from the community is overwhelmingly that this work is needed, it's appreciated, and a 2020 evaluation led by Dorothy Wigmore found that the train-the-trainer model and outreach are very effective. Dorothy, do you want to speak a little bit about the communities and partners work that you led?
No, just to say that there are 2 documents here. They're on the website for the center's website, as well as the Manitoba CCPA one. I wrote a lot, so there's a background document as well as a main report that involved talking to people on the advisory committee for the program, talking to some of the trainers and the OHC staff that were working on the program, and coming up with recommendations for a variety of parties from the center itself to the government or governments. It's if you want to learn a little bit about health and safety, it's in the background document. And some of the background document also includes some stuff about this community development approach to things.
Thank you for that context, Dorothy. So the program has been funded in the past by the Workers' Compensation Branch, by the province of Manitoba, and in the most recent past by Immigration, Refugees and Citizenship Canada. Unfortunately, the CCDP was not selected to receive ongoing funding in the latest rounds of funding agreements by IRCC, and is now being funded in a limited capacity by Shared Health. So as you can imagine, over that time, particularly with IRCC, international students were not one group of folk of newcomers not covered by funding. So although the train-the-trainer approach and the outreach model of the CCDP was very effective, and newcomers reported that they felt increased efficacy to seek a redress whenever they maybe their rights were trampled on or they got hurt at work, they understood their rights, they felt more equipped to speak up when they were maybe made to engage in unsafe work. That work could not be extended to international students because they were not funded through IRCC. So there was an opportunity then for funding through Manitoba Settlement Support Services that the Occupational Health Centre pursued in 2023, and in which an 8-month project was funded, sort of on a truncated schedule due to just the delays in getting contracts signed and whatnot. But over the course of 8 months, we were funded to develop this needs analysis reports, to engage in research on international students in Manitoba, the issues they face in the workplace, and also to deliver workshops on occupational health and safety, similar to the work that had been done with the CCDP, but now extending that to international students. So looking at international students in the workplace, it's important then to just understand some of the current legislation and government rules that affects them and impacts the ways in which they're able to exist in Canada. Between 2018 and 2022, Manitoba issued an average of about 20,000 study permits to international students. So that doesn't mean that about 20,000 people came every year, but about 20,000 study permits were issued. If a foreign national holds a valid study permit, they may be able to work while studying without applying for a separate work permit. So that means that they're not entitled to be able to work and support themselves. But as long as they fit certain criteria, most notably maintaining full-time status during the fall and winter terms, and there's not like a restriction stated on their study permit, they may be able to work. Immigration, Refugees, and Citizenship Canada has specific criteria about working while studying, which I just mentioned. And this has changed in the last few years, and most notably, it's changed in reaction to perhaps labor market needs and not necessarily what's in the best interest of students. Most notably, over the waves of COVID-19 induced lockdowns, the 20-hour a week limit on working was lifted, and students could work up to full-time hours during the fall and winter terms on or off campus. But as of September 2024, a cap has been reinstated and is now set at 24 hours a week, which usually translates to 3 full-time shifts. Sorry, 3 8-hour schedules, which is what we hear from students through this research. So some students in certain programs are exempt from working. Thank you, Dorothy. And so it's important now to just consider that context with things that we do know about newcomers in the workplace, such as this research by the Institute for Work and Health out of Ontario, which again affirmed that newcomers in Canada are more likely to get hurt or sick at work compared to Canadian-born workers. This is influenced by things such as hazards in the workplace, outside of the workplace, inadequate policies and procedures, and also the quality of work available to newcomers. So this makes them vulnerable workers. So in the context of occupational health and safety, that means they have an elevated risk of occupational injury or illness. Newness is a risk factor, so this is not necessarily an age thing, but really is a newness to the Canadian work context or newness to even a job. A survey instrument, which we used and we'll share a little bit of data about, really is used, the Institute for Works and Health vulnerability measure is useful for highlighting what hazards, gaps in OHS policies and procedures exist, as well as gauging the awareness of hazards, rights, and responsibilities, which can be useful in then tailoring specific programming or resources to meet the needs of specific employers, groups of workers, or specific workplaces. Through the work of the Institute for Work and Health, it's also been identified that some employers report that they struggle to provide newcomers with occupational health and safety training and support, whether that's due to language barriers or employer capacity. So the employer doesn't necessarily have the skills to provide this training, particularly to newcomer workers. So with this background information in mind and this context, and I think it was important for us to really use a mixed methods approach to develop this comprehensive needs analysis, needs assessments on international students who work to support themselves in Manitoba. We wanted it to be community-driven and reciprocal. So we wanted participants to learn about some basic health and safety principles, learn about their rights as workers, to leave feeling empowered, leave feeling with an increased sense of efficacy and not necessarily dread and doom about the fact that they are just vulnerable workers who don't have much room for redress. And to support the primary data we gathered from students, we also wove together relevant academic literature about international students in Canada to supplement our findings and see some of these reports on the page here. Thank you for these wonderful animations and images, Dorothy. Appreciate it. So recommendations are based on analysis of literature and data, combination of both. The data really is affirmed by the literature and reflecting the possibilities for change to improve the lives of these students in general. Their health and safety at work is the focus, but improving their health and safety at work will improve their education outcomes, will improve their settlement outcomes and long-term, and then their long-term outlook in Canada as well. Thank you, folks. That's a lot of information from me. Just a few more slides, and I'll pass it back to Dorothy. But just want to highlight how we did connect with students. So we spoke with student groups, university, college staff, settlement agencies, and other stakeholders on a one-on-one basis. We also developed an online survey to collect data about students' labor market participation, the employment rates, the types of jobs they worked in, and the hazards that they were exposed to at work. In addition to that, like I mentioned, we used the OHS vulnerability measure developed by the Institute for Work and Health and asked those who attended the in-person sessions to fill it out, as well as making it available via our online survey. And then finally, we facilitated 3 focus group sessions. one online and two in person, in order to hear directly from international students about their job-related experiences, particularly around health and safety. And keeping in mind with that reciprocal process, all participants received a $50 honorarium as a token of appreciation for their time and efforts. I just want to highlight some of the things we heard from the online survey. So most respondents, about 63%, did not receive or could not remember receiving health and safety training for their jobs, which is particularly disappointing because it's the employer's duty to do this, as we see here on the screen. So 4 participants had specific training before any new task, which is a legal requirement in Manitoba, but only 2 had WMIS training, something that is legislated provincially and nationally as late ago as 1988, not the 1800s, sorry. 21% of participants had been sick because of their job, and more reported job-related harm, including exposure to COVID-19, being injured at work, being assaulted at work, or being injured during travel to or from work. This caused stress, depression, migraines, injuries, panic attacks, and really limited their ability to work and study. And as one participant put it, on their way from work, they fell into the ground and hurt their wrist. And because of this, they went to the doctor and found that they had fractures in their wrist, right? So they were wrapped in a bandage and limited their ability to work, as they're a coder, as you can imagine as well. They're studying computer engineering and limited their ability to do that as well. As students are not as students may not have access to comprehensive healthcare coverage in Manitoba through the provincial healthcare plan as of this time, we did hear that a lot of students may not go to the doctor when they've been injured at work, that they may, repress symptoms, which, as you can imagine, then has a more debilitating effect on their long-term health, on their ability to participate in school and have good outcomes from that.
The other thing that we really heard in the focus groups, quite to my surprise, or maybe not, was that these folks, hardly any of them knew that the workers' compensation system existed or that it was relevant to them. And that's the kind of thing. That's one of the things that the cross-cultural community development program had focused on, was workers' rights, not just in terms of health and safety, but in terms of workers' compensation as well. And I can't remember whether this person or the people we heard this from, I can't remember how many, if any. I think there was maybe 1 or 2 that in the focus groups that actually had heard about workers' comp and knew that it applied to them.
Mhm. Thank you, Dorothy.
So in terms of the focus groups, which I was talking about there, all I'm just giving you here the sort of the basics that the process we used, which was starting with the land acknowledgement introductions, and those introductions, we asked people about their country of origin, where they were studying and what they were studying, as well as what kind of work they were doing or had done. We talked a bit about our purpose and approach, and then focused on people's experiences at work. So we had them in both we did online and in person. And in both cases, we had them do body maps using this scheme of looking at aches and pains, green for where stress shows up, and blue for other kinds of symptoms. And we used that to introduce the topic of workers' compensation as well. Then we looked at what makes it hurt. So talking to people about hazards, the handout here, what causes our symptoms, was distributed. And we got people to connect the body maps that they had made with the hazards, tried to talk a bit about prevention and the principles of dealing with hazards. And then we also did an activity around asking, how does work affect your life as a student? And at the end, we had this question about how does your gender, first language, nationality, or cultural background affect your life here in Manitoba? And that's where some of the yearning came out. And then we talked about next steps and promising people copies of the report, etc. In terms of where did the students work then, what we learned is that worked in mostly part-time. The jobs had a range of hazards. So the sectors included fast food, retail, the kinds of things you'd expect, healthcare, settlement services, people working in technology, child and respite care. There were some folks working in youth support or group homes. A number were taking part in campus-based activities. And surprisingly, in some ways, a few people were doing construction. So in terms of where does it hurt, that question that we asked and used body maps for, this is what the online focus group results looked like. So again, the red is aches and pains. We didn't get to the blue because of some technology issues, but the green is where stress shows up. And as I tend to point out to people, there is often an overlap between where stress shows up and people have these aches and pains or musculoskeletal issues in the neck, shoulders, and lower back. And it's because stress will set us up for aches and pains issues in those areas. And this is what it looked like. This is the combination of the two in-person focus groups where this time the blue was able to be added. And what we would do was say to people, okay, so, here's what's the story here with the ankle? What's going on with the lower back? What's going on with so many stress markers on the face there, that kind of thing.
Just want to highlight some quotes we got from students as to what we heard from them. So this first one was from a participant in an in-person focus group study. They were talking about how they developed a latex allergy from a dishwashing job and simultaneously an allergy to Dawn dish soap. So they found out that's it's a common problem for people who have more extended exposure to that specific dish soap, and it was a hazard that they were not made aware of before they started the job. Participants brought up economic design hazards as well, related to lifting children and objects, particularly for those working in youth support or childcare roles. For both my jobs, I have to lift super heavy stuff, heavy furniture sometimes, or just what I have to set up for the kids, such as moving play structures or tables and chairs around. I have to bring soccer nets or so many stuffs up. So they're not sometimes set up to also, take their time to do this, take multiple trips, as there's maybe there's less staff per the number of youth. That would be ideal, right? For an asbestos abatement worker, someone working in construction, with what he said was good training. So this, I believe, was one of the only participants who was aware of WMIS and the workers' compensation branch. I would say that the fact you're going nonstop, so you could be doing something maybe in an hour you would be tired, but you have to do it for 8 hours. So it's the fact you're doing something intense nonstop. I think that's where the stress comes from. So they're highlighting the fact here that the pace of work and the fact that it is strenuous work for 8 hours at a time is something that is a source of stress for them. And then someone who put out a green stressor dot on their tummy there in the image, they shared that every time they go to work about an hour before their shift, because of the fact that the job was hazardous for them. They taking care of Indigenous youth, most of which were violent, and also just a recurring theme we heard is that international students in these part-time roles often are perhaps the only ones in a situation where they would be better set up with multiple staff, force on have support to respond in these sort of crisis incidents, as well as we shared earlier, the fact that they're not receiving on-the-job training, receiving proper instructions on how to engage in these conversations, lead to them feeling stressed. They never know how the night would go, so they get really bad tummy aches just thinking about going to work. And then for a food delivery worker, sometimes working in minus 20 degrees temperatures, they shared that the cold was a hazard. So in their words, many times working in deliveries, many times the consumer lives in a building and you need to wait for them outside. And people say, oh yeah, I'll be right there. I'm just coming. I'll be there in 5 minutes. But many times it's not 5 minutes, it's 10 minutes. And again, the fact that they're not paid for the time they have to stress is they have the time to wait is also a source of stress. So they're waiting for extended times in the cold, so it's like almost a double negative in that instance. And the fact that they're also waiting, in environments they may not be aware of or may not be comfortable or familiar in at on hours of the night as well to make these deliveries.
And the other thing is that, if I remember rightly, this person was from a part of the world where it's rather warmer than we are in Canada. And so his experience with the cold was quite limited. So and his ability to deal with it likely was not as good as somebody who's lived here for a long time.
Exactly. I still remember, my first few years of going to the U of M, seeing people wear shorts in the winter, right? Like, I don't think that'll ever be me. But
Yeah. So looking at some other things that we heard, this whole thing about sleep and time was a constant theme, and this came from the drawings that we had people do about how does work affect your life as a student. So these are some quotes here. This person is talking about getting paid. Having to pay, first of all, tuition that's really high, and then just getting paid minimum wage. And so because of the rules, they were able to work full time in 2023, got set up for that. But now that they can only work 24 hours in a week off campus, they had to readjust everything. So money was a big issue for them. And the second one was lack of sleep. So um, uh, the noise, this person talked about getting a ringing in their ears, which is something called tinnitus or tinnitus, which is often, not always, but often is a result of people working in noisy environments. And then there's also this emotional burden of maybe getting hurt at work. This point about that Hafiz made earlier about students not having access to healthcare unless they buy insurance, and saying I don't have money to fix my leg if somebody broke it. Not understanding again that workers' compensation would was supposed to come into the picture here if they were hurt at work. This person talked about getting headaches or backaches enough so that she doesn't go to school, or just and taking coffee and energy drinks to stay awake. I know it's not good for me, but that's the only thing that can get me to go to class and listen and participate. And others also talked about using coffee a lot. Somebody else also was talking about working in a daycare, bending over, changing diapers. It's how demanding it is. This is a daycare at the university. So they have to fit it in with their schedule, go to work, go to class, run back to work, run back to class. It's just, especially in the cold, it's very uncomfortable. And then the sleep theme, because with kids, because there were people who have kids with them, but in this case, she's talking about having to be at work at 8:30. You have to take the bus, having to get up at 6:30 to be ready, and to be at work before 8. So lots of coffee to stay awake, which affects her health. And Hafiz, if you want to cover this one.
Sure. Thanks, Dorothy. So something that we also heard from participants is that they do face discrimination and racism in society, and particularly at work. And in one participant's words, in one of my previous jobs, I faced racism for being brown as a door-to-door salesman. And in others, some coworkers talked to me too condescendingly, assumed I wouldn't know things because I have an accent, acted surprised when they found out I had superior education. I was discouraged to apply from jobs because it stated they were looking for Canadians or permanent residents. Job postings had filter questions about status, etc., which, as you can imagine, does not, pertain to their ability to do the work. This is something that we continue to hear from all groups of newcomers, as I have, doing work in settlement, is that Canadian experience is a barrier for people getting jobs, even if they have experience in other Western countries. The fact that they're a newcomer and have not worked in Canada is a reason why they may be excluded from working. And as this international student shared, and as a lot of folks who participate in our studies, right? So taking an intersectional lens, the idea of an international student might be someone like me who moved here as a later teenager, right? But we also had folks who were parents, folks who had long fulfilling careers in their home countries before coming, who would be eligible for these high paying jobs as students, which they would be very capable of, performing in. But the fact that they were students and were racialized precluded them to discrimination and racism, and they were not able to, as this person shared, they were even discouraged from applying to jobs. And it was really disheartening because I remember the participant who shared the fact that they faced racism being a door-to-door salesman. They were really bubbly and were really a light in our in-person session, right? As you could imagine, in these door-to-door salesman roles, they're really exposed to a lot of hazards, such as working out in the cold, assault, or even a verbal or physical assault from the public, and again, racism from all sorts of manners of people you're being exposed to, who may just be peeved at the fact that you're bothering them at their door, and then coupled with existing bias, it comes out as racism.
And the other thing that I think of when I think of people doing stuff door to door is the hazards from dogs, which are the same things that postal workers face, or perhaps I don't know of vicious cats, but the dog issues are something that could probably come up.
Well, very real. I know someone who got bit canvassing last week.
So in terms of, we asked this question about how does work affect your life as a student? And I just want to show you some of we asked people to draw, and then they said they weren't comfortable with drawing, then, they could write. So this person talking about it, if you work, it's difficult to do other things. Can be hard to focus on the studies after work, and it's hard to work the legal limit and make enough money. This came from the online focus group. This person talked about the time monster and how there's never enough time to get things done. And although this is difficult to see, this is also from the online thing. And I think what the person wrote or said at the time is really important, to how they feel like they're constantly drowning in between getting to work and managing their school life. I feel that it's always contradicting between being a student at day and being a bartender at night. I literally misplace where I'm supposed to be sometimes. So that's why I say I'm literally falling, and he meant into loneliness. And that's what the writing there talks about, the loneliness. Somebody else talked about physically demanding things, character building relationships. Money is an issue, and we asked them also what they liked. And so things like memories are the friends that we make along the way. Again, tiredness, stress, and time. This person, there were a number of people who had families with them. And so not only are they dealing with their own work and studies, but they have family responsibilities as well. So Hafiz, before we go on to that, one of the things that I know the title is talking about is yearners. And we just didn't manage to get something in here about that, but I wondered if you could say something about
I was actually going to say something on the next page, because I think
okay.
provincial government, but also just want to highlight, sorry, because there is so much. This work really was rich. I didn't mention this earlier, but we had 19 full survey responses and 21 full responses for the OHS vulnerability measure. And looking at those responses, about 80% of international students can imagine exposed to hazards, and a majority of them have inadequate policies and procedures. So just combining the data that we got from that and this primary information from the students we found, it really is paints a bit of a dour picture in terms of what their OHS outcomes are. Mm-hmm. And thank you, Dorothy, for that plug there. So the Yearners title, I also want to give a shout out to Miriam D, who put out a doctoral thesis on this particular topic. And their methodology was to engage in a one-on-one interviews with students. And from that work, and as a former student and just someone in this space, a lot of students are yearning for permanency, are yearning for a sense of belonging. And a lot of students do come to Canada with the intention of, becoming permanent residents. Reflecting on my experience as well, the materials we're exposed to in terms of marketing Canada, marketing post-secondary institutions in Canada, very much so relies on that messaging, on the fact that it's a world-class education that will provide you a pathway to world-class employment and a better standard of living that you might have had in your host country then. So it really is sad to also combine this with looking at what we've heard from students and also the experience of students over the last 5 years since the first waves of the COVID-19 epidemic. So globally, there has been significant economic downturn. There's been significant currency devaluations in the countries in which we come from. And despite that, there's not been an increased amount of support in Canada, and there's not been an increase in scholarships for international students. There's not been an increase in subsidies or funds to support people while they're here studying. Instead, we've had an increase in the amount of funds that people have to prove that they're able to that they have on hand to support themselves in Canada, which in theory makes sense, but again is perhaps built on a false assumption and sort of oppose systemic racism, because not many Canadian-born students have that cash equivalent on their hand. They may have it in social support and in non-monetary support from their family, which does contribute to improve their education outcomes. But really, it is as we all know, it's a multi-tiered system for international students. Not only the fact that they pay 3 times as much, but as we get a better appreciation, I guess, of our Charter of Rights and Freedoms in the fact that the legislation is set up to codify them as second-class citizens. They're not entitled to work. They're not entitled to full-time work. They're not entitled to full participation in the labor market. They're not entitled to be able to support themselves. They're not entitled to provincial health care. Reflecting on still when that was taken away in 2018, it was an economic argument that was made that didn't even make sense, right? So the cost savings was peanuts compared to the economic value and community value that international students bring to Manitoba, right? So with that in mind, and thankfully this is my little spiel there, I just want to close our chat today with some recommendations, starting with recommendations from the Manitoba government, really highlighting the work of Dr. Lindsay Larios, thank you, who's here today, Judith Oviosin from the Canadian Federation of Students, and other great folks from Healthcare for All Manitoba, Manitoba Healthcare Coalition, who've been pushing for this, and student groups to restore provincial healthcare coverage for all international students in the province. So this healthcare coverage should not be tied to the full-time status, should not be tied to any other forms of mean testing, but is simply an entitlement based on the fact that folks are students, residents in Manitoba. It really would go a long way to reduce long-term debilitating outcomes. Something we didn't really get into as much today is the fact that, again, just taking an intersectional lens, students who are maybe disabled, students who may have chronic illnesses, students who may be birthing people are going to have an even worse time because of the fact that they don't have access to provincial comprehensive healthcare coverage.
Yeah. And the other thing I would add here, Hafiz, is that when we're talking about provincial healthcare coverage and the fact that so many of these students don't know they have a right to workers' comp, at least if they had provincial healthcare coverage, they'd be more likely to go off and see some kind of healthcare practitioner that can help them if they've been injured or got sick because of work.
Definitely. Thank you. That's a great point, Dorothy. Just that we didn't correct this data, but just asking anecdotally in our focus group sessions, not a lot of our participants have family doctors as well, right? So that's not access to an ongoing person who knows your body, and may be able to identify an MSI before it becomes something more debilitating even.
And that's why advisory groups would be really a good idea.
Exactly. So that's what we're pushing for. The provincial government is set up an advisory group with representatives of international students who work and those encountering them as well. Develop and implement effective and ongoing staff training about the unique needs of international students who work, so that policy analysts are better informed about what the effects of changes are.
And that the people like the health and safety inspectors think about this, people at Safe Work Manitoba, people who deal with students in other ways through the provincial government.
Exactly. And that's why, it's all really connected. That advisory group perhaps could also support those folks in developing ongoing training, and also looking at how racism, extends beyond interpersonal and, one-on-one incidents of racism based out of bias, but also to systemic racism, to things where someone who maybe doesn't have an intentional or an individual bias may still be carrying out the dictates of a system that marginalizes specific people, like looking at provincially our shared health mandates. Are we calling border patrol enforcement on people who can't pay their hospital bills in a timely fashion? Like perhaps that is the experience that we've seen reported in the community, and that's something that is not grounded in the best interests of students, and something that only comes out of the fact that students don't have access to comprehensive provincial healthcare at this time. So another recommendation would be develop and implement effective information, inspection, and enforcement programs. So shifting from a reactionary model to a more proactive model to reach employers that have a high percentage of international students, to ensure that students are made aware of their workers' rights, of workers' comp, and that the claim suppression isn't going on. And also encouraging the government to fund programs like the CCDP to educate international students about occupational health and safety and workers' rights, and to also bring back an integrated strategy that acknowledges the long-term contributions international students make to the Manitoba economy. Under the previous NDP government, there was an international education office that did do things like this, that had advisory groups and worked to develop effective training and really cater to the needs of international students, acknowledging the long-term contributions they made and thinking about integrating them into long-term industrial planning, thinking about integrating them into the economy and our communities through things like specialized pathway programs to permanency, including spots in the NPMP specific for Manitoba international students or international students from other provinces as well, and just pushing for more things like permanent residency for all as well. Just more accessible programs and accessible systems would really go a long way to improve the outcomes for international students. Our recommendations for the Manitoba Occupational Health Centre specifically are to expand the cross-cultural community development program to include international post-secondary students, which it currently can now do actually, although in a diminished fashion through the funding of shared health. If any folks on this call support international students and would want to offer a CCDP-like workshop on workers' rights, on access to benefits, and just information on occupational health and safety for international students, that can be organized through the Occupational Center and CCDP. So also recommending that the OHC produces or that it continues to adapt resources specific to international students' needs. So looking at what channels are students using these days? What is the ways in which information is being filtered to them? The Safe Work Manitoba has a lot of great resources, a lot of great videos, about 6 to 10 minute long, that a lot of students have never been exposed to. So something that the OHC was able to do through this work is to do the work of exposing some of that resources through them through stakeholders at communities, groups, at universities, and also through developing 2 short-form content videos about a minute long on workers' rights, on how to make a WCB claim or what to do if you're injured at work, which will be made available to students very shortly. So the hope is that those continue to live on and disseminate organically through students. And it's a way in which they're just exposed to this, that they get to know the fact that they are eligible for WCB, the fact that they do have these rights, including the right to be free from reprisal. And also recommending that the MFL OHC perhaps expand the CCDP advisory group to include community partners who support students and international students as well as review the communities or partners reports, which we mentioned earlier, for the recommendations that are applicable for international students. And then once the government of Manitoba has approved, share the needs analysis report widely, and as well as the recommendations with the government stakeholders, community organizations, and through the OHC's channels. And then lastly, we have some recommendations for community groups and post-secondary institutions as well. So ensure staff are trained on the basics of occupational health and safety and workers' rights. Work with the MFL OHC to prepare digital and print resources specific to international students seeking a job. But for seeking a part-time job is a primary concern of students. A lot of them need to support themselves economically while they're here, but they do need to know their rights. They do need to know the fact that they are vulnerable workers and the fact that they do have opportunities for redress unless these negative outcomes will continue. And we also recommend that community groups and post-secondary institutions work with the MFL OHC to advocate with government departments about training programs and other measures to address the needs of international students who work. Just want to commend some post-secondary schools and community groups that are doing good work, particularly in the universities, on the fact that some staff now are trained to officially be able to give not necessarily immigration advice, but answer questions on immigration, on pathways to permanency, is really appreciated by students. Of course, that yearning piece is a primary concern of students, and if they have more access to this support, is something that will be beneficial for them in the long term, and will also be able to help better reduce and some really negative trends, like the fact that the median wage for international students is 20% less than the median wage for Canadian-born students, at least within the first 3 years of graduation, right? A lot of that is the fact that these folks are vulnerable workers. Most of the time while they're students, they're working in part-time jobs that are not connected to their training. So they're graduating without connection to the hidden job market, without connection to informal networks and resources, and most likely will continue on that path of vulnerability, right, earning less than they potentially could with their Canadian training.
And I just want to make the connection here that while you're talking about people's about the tuition people pay, about the healthcare they don't have access to easily, about the job, how much they're paid at work. There's a lot of things in there that connect to being essentially our stressors that have much to do with the context in which students are working. And so if they're working in hazardous, crappy jobs that don't pay very much, other things like trying to pay for living expenses and other things, just really, it's hard to separate things out. And so many of these things are, we can't just look at them separately. We really have to look at them in an integrated way.
Thank you, Dorothy. That's a great point. It's a very integrated and very intersectional problem, right? Because some students are coming with $30,000 cash, but that's not the norm. And some students are coming without childcare or caregiving responsibilities, right? But that's not everyone. So I think it would be beneficial if we have systems that are accessible for the least of us, so that we're all able to really enjoy sunny days, sunny ways. But
Yes. So
thank you.
that's it from us. Our question is, what are your questions? I see there were some things in the chat. I'm going to stop the share. Were there questions in the chat?
No, that was just me putting in the resources, and then Emily from the WCB letting us know they had to leave.
So you had some suggestions about if people had no questions. You had something for people, Hafiz.
Yes, folks. Thank you for listening to our information there. Really appreciate you taking the time to learn about this work, and just appreciate the work that a lot of you do to support international students every day. Just curious if folks are comfortable answering with their cameras and audio or in the chat. Why are you here this morning? Why did you feel like it's an important discussion to be part of? Thank you, Alicia.
I'm going to pick on Andrew since I know him. I see something here from.
Thank you, Lorinda. Andrew, you have 5 seconds. Lorinda, thank you. Lorinda works in occupational health and sees many newcomers to Canada for employment.
Right. And those newcomers include students, do they?
Yes.
Yeah. So it's there's this real parallel between the experiences of people who were classified as newcomers and those who are classified as students, because international students. So Safe Workers of Tomorrow is another program that speaks to newcomers, and perhaps we could make a point of sharing the report with them, Hafiz.
Definitely will do. We'll make sure to share the report with everyone who registered as well. We're just waiting on information, how it is from the funder that
Yeah.
there. I do have a follow-up question. Thank you folks for being here. How will you share what you've learned today and ensure international student workers have better health, education, employment, and settlement outcomes? Awesome. Thank you, Lindsay. Really appreciate the research you do on access to health for precarious status migrants, including students. And Lindsay has been part of advocacy efforts for healthcare for all and MEMBI Coalition. Really appreciate this report. Thank you. We had a photo of Lindsay in there as well. I just want to quickly take a time to also thank folks for their support on this work, including Dr. David Canfield, Dr. Lori Wilkinson, Dr. Adam King, and Dr. Lindsay Lyers from the U of M. Jose Chinchilla and Leila Castro from Seven Oaks, as well as the folks from West Central Women's Resource Center, and Rika Ursos and from Canadian Mennonite University, as well as Crystal Stewart from U of M. I really appreciate everyone who connected with us to provide feedback on the issues that international students are going through, on the ideas of how we can make the systems more equitable and accessible. I think it really made the research a bit more rich, and also informed the work that I did to educate students to ensure that they were understanding their health workers' rights, their means of redress, and that if they came across this program, that they left feeling more empowered to share information and to speak up if they were exposed to unsafe work.
I see that Alicia has said she's a WHS officer. I'm trying to guess if that means you work for the provincial government, and that you want to ensure that newcomer students are supported by the department. That's one of the reasons, excuse me, one of the recommendations is that government staff, like enforcement folks in health and safety, are more aware of and the situation that international students face, and the fact that, like many newcomers, they really aren't aware of their rights. They're afraid to speak up for fearing retribution in some way or another. For the students, like other newcomers, income is really important. And the thought of losing your job because you say, hey, this is really, you shouldn't be asking me to do this. This is hurting me. I can't breathe easily, whatever. It's hard to say those things, but if the people enforcing workers' comp or health and safety laws don't understand the situation that these students find themselves in, it makes I just think things are being missed in terms of getting needed changes in various workplaces. Sometimes it's just employers just don't know what the rules are and don't appreciate the difficulties. Well, Hafiz, I think we're done.
Yes, awesome.
With thanks to those who stuck around. Thanks to Tiffany for her usual pulling things together here.
Honestly, thank you, Tiffany, for making this happen.
On behalf of the Occupational Health Centre, thank you, Dorothy and Hafiz. In that 8 months, you did a lot actually in that program, right? 8 months is really, really short. It's not long enough, but this is a long way. We need to do more and more to support international students. So thank you for all the report, the findings, everything. You did the presentation, the focus group, and all the funding you share with us. So, we really appreciate all your hard work. And also thank you all the participants here. So, and have a great afternoon and happy spring. We will see you next time though. Thank you. And that session has been recorded and will be shared with you when this is available with the slide as well. Okay, bye. Take care, everyone.
Thank you all.
Thank you.
Bye.
So